everybody. This is Joe Freudenberger, CEO for OakBend Medical Center, coming to you today with another Cup of Joe conversation about healthcare topics. I'm joined today by Dr. Ed Uthman, retired pathologist, had been with OakBend over 30 years, and thankfully has continued to serve on our board. But he is a very well-educated guy that can help illuminate a conversation that we're having these days around vaccines. So let's start off and talk about why do vaccines help us? I mean, how do they help prevent some serious illnesses? What's the mechanics here?
Well, vaccines are arguably the very first science-based medical modality. Okay. And this year celebrates 230 years of vaccines. It started off with Edward Jenner and his discovery that cowpox can prevent smallpox.
Okay.
And just based on that clinical observation, he developed this technique which worked. And in fact, it did work until to the point where smallpox was eradicated. So that was
So how does it work? I mean, what does a vaccine do that helps us to avoid, in this case, smallpox or many other diseases?
But what they do is sort of the best way to think of it is they do what the germ itself would do without harming you. So when the germ comes in and causes an infection, it harms you, which is why we don't like infections. And but if we can get the body to respond to that infection before it gets established without harming the body, that would be an ideal situation. So that's what a vaccine does, is it stimulates the immune system to fend off an infection by a living germ.
So it basically supercharges the immune system.
Right.
Specific to the disease that the vaccine is intended to address. So it activates that part of your immune system that fights off that particular disease.
Right.
Okay. So let's start off with children. Are there vaccines that are more important than other vaccines? Because I understand there's a bunch of vaccines that are now being administered to children. I'm sure they're all valuable in some degree, but are there some that are more important than others, in your opinion?
Well, of course, infectious diseases are not distributed evenly in the population. There's some parents in some environments that would be more susceptible to some diseases than others. So it's kind of complicated. The good news is that there are widely accepted consensus recommendations as to who should get vaccines when. And the best place to find that for children is on the website of the American Academy of Pediatrics.
Okay.
So you look there, you can see exactly what your kids need and when. Okay. And that's the best way to do
okay.
that.
How about for adults? Are there vaccines that as adults we should be looking carefully at and seriously at?
Yes, so a lot of it depends on, like for me, when I was practicing, I had a lot of contact with blood and body fluids, so I definitely wanted to be vaccinated against hepatitis B.
Gotcha.
So other people may not really need that vaccination, so that's something you can discuss with your doctor.
Okay.
In terms of looking for adult vaccines, you can go to the American Academy of Family Physicians website, and they have good recommendations there.
I recall people saying if you're over 65, I don't know if I got the right age, you should definitely get a pneumonia vaccine and a flu vaccine. Is that still?
And shingles, yes.
And shingles?
Yes.
Okay. And shingles is a one-time set of shots. It's like 2 shots and you're done.
I believe that's right.
But pneumonia and flu, you kind of have to do each year.
Yeah, I mean, and you have to look at the specific recommendations. There are some changes in them, so it's important to keep up to date with them, which I don't do since I don't have to prescribe those kind of things.
Okay. All right. So vaccines do more than just protect ourselves. It protects others around us. How does that work? Why is I guess that's herd immunity. Why is herd immunity important?
Once you get to a certain level of protection in the population, so a certain percentage of the population is immune, then the disease cannot develop the critical mass to spread extensively.
I gotcha.
So
it's not fertile hunting ground for the disease any longer once you have herd immunity.
That's right.
Is herd immunity a number, or is that?
Well, that's I suspect you would probably find different opinions on that, but theoretically it is a number. Whether people agree on it, I'm not sure about that.
Well, what's the range that you hear discussed as to what constitutes?
Well, I think 90% would be pretty good.
Well, that'd be good, but I mean, is that necessary? I mean, if we're
Well,
at 80%, vaccinated, does that really slow? I would imagine whatever percentage is going to slow down the disease to some degree.
yeah, but that's, I mean, you'd have to use your math knowledge to go. You have to use the E value.
Oh God!
Okay, remember
Oh
that?
God!
For those kind of
Let's
things.
not go there.
You want to talk there about that?
No, definitely not. So, what do you say to somebody who has concerns about vaccine safety for their children?
So people seem to these days want to be assured that the vaccine is 100% safe, that it's never caused any kind of problem at all, and it prevents 100% of diseases. There's no medical modality that performs at that level. So I come back to a term that you see in the legal profession more than the medical profession, although I think we should use it more, and that's the reasonable person standard.
Oh, okay.
So I'm not going to lie to someone and say that, there's a give you 100% chance you're not going to have any kind of side effect from this vaccine, when I know that's not true. But I will also say with equal fervor that a reasonable person with full knowledge of everything obviously will opt for vaccination.
Gotcha.
Because the benefits overwhelmingly outweigh the risks.
Okay. So the RSV vaccine for adults is relatively new. Who should consider, or under what circumstances should a person consider getting the RSV vaccine?
I think it's recommended for everyone in their senior years. I'd have to look at the recommendations.
Senior years is?
Well, typically we say 65, but again, I'd have to look at the
that's a senior, huh?
That is senior.
Oh,
yes.
Gosh.
It doesn't seem senior to me much anymore.
No, I agree. Definitely not senior. Definitely. Can you receive multiple vaccines together as an adult?
Sure. And some vaccines are actually combined in one shot. Like the most common one would be measles, mumps, and rubella.
That's for kids.
MMR.
Right. And then we have to get those sometimes now when we have grandchildren. We have to get some refresher vaccine. What is that?
The Tdap.
Tdap, right?
Yeah.
And that has multiple.
Tetanus, diphtheria, and pertussis.
Okay, so that's 3 vaccines.
It is.
Together.
And it's been around for even longer than
okay.
MMR.
I remember that because my children told me, no, you can't come around the grandchildren until you have your Tdap. So, okay. Are there different recommendations for vaccines if somebody is pregnant?
Yes, in fact, that'll be the third website I'm going to mention, and that's the American College of Obstetrics and Gynecology. ACOG.
Okay, ACOG.
So that's where to find the recommendations for pregnant women.
Okay. So if I'm traveling internationally, are there vaccines do you have a fourth website for me on this international travel?
Now that I don't, but I would look, my first place I would go to WHO.
Okay. World Health Organization.
And see what they have to say about it.
Okay. So certain countries have certain diseases that we don't see, like malaria. We don't see much malaria in the United States, but if you're going to Africa, you may have, or the rainforest someplace that may be present there, right?
Yeah, and I mean, malaria, that I don't think they use vaccines for that, but there are drugs that will prevent infection or serious illness if you do get infected. Okay.
And what is the best way for somebody to determine which vaccines they might need to get, a booster on, and what they should do if they don't have a complete vaccination record? So let's start off with, how do we determine when we need to get boosters or new vaccines? And then if we don't have our vaccine record, how do we get that? But let's start off with the first question.
Yeah, so that's again, you have to go to the recommendations because they are fairly complex.
Right.
And you just kind of go through that algorithm, and it's all common sense stuff, but somebody's written it down and you just refer to that.
Okay, so let's go over our websites again. We got, for pregnant women, the American College of Obstetrics and Gynecology.
Right, ACOG.
ACOG. For children, the American College of Pediatrics.
American Academy of Pediatrics.
American Academy. They couldn't all go by college. You have to change.
No, you got to
American Academy of Pediatrics. And then there was a third website you talked about for adults.
So that's the American Academy of Family Physicians.
American Academy of Family Physicians.
AAF.
And then if you're traveling internationally, go to the World Health Organization for their recommendations on vaccines or drugs as preventative drugs that you might need to take depending upon where you're going.
That would be the first place I would go.
Okay, and if I don't have a record, my vaccination record, you know, my mother wasn't good enough to keep the record, and I need to go find it. How do I do that?
Well, it's gone probably.
Oh, thank you.
But honestly, you don't really need it.
Okay.
The recommendations are independent of your record of childhood vaccinations.
Beautiful. All right. Well, thank you very much, Ed. This has been very informative. I got all sorts of new acronyms that I got to process. Thank you all for joining us on another Cup of Joe. I look forward to seeing you another time.